Good evening, people. How are you all doing? My name is Kavitha, and welcome to a live session of Tots and Moms. I'm founder of Tots and Moms, and recently we have started to bring in specialists to talk about certain topics which are definitely worrisome. And when you hear it from the specialists, like doctors or nutritionists, you know it is right, where it is coming from, and what to do and what not. You can also get your questions answered here, and hence people love to follow our live sessions. And if you are here, do continue watching it till the end, because we can also take up your questions. So menstrual disorders is the topic today, and Dr. Anuradha Rao is joining us to answer the queries related to menstrual disorders, be it fibroid, infertility issues, thyroid concerns. All these affect women's life day in, day out, and it is very crucial and necessary for us to understand the reason. And homeopathy, she is a homeopathic doctor, and she really says and swears by the medication and treatment which is available in homeopathy. First, we'll talk about all the questions that we have noted down, and then we will slowly take your questions. So please be there in the live session, and we will keep.
Yeah. Amazing, Dr. Anuradha. So good to see you. How are you doing?
Hello, good evening. Yes, I'm doing good. How about you?
I'm good, doctor. It's very nice to see you, especially giving us time. Apart from your online sessions that you're taking up, the care that you do, and you are a month of a you are a mother of a 4-month-old child. So that is amazing, I would say. Congratulations on the new arrival, first of all, doctor.
Thank you so much. Thank you so much.
Okay, our audience would love to know about you more. I have just told them that you are a homeopathic doctor. I am sure there is a lot that you would want them to know. Please give them a brief introduction about yourself.
Good evening, everybody. Myself, Dr. Anuradha Rao. Basically, I'm from Bangalore. I have a clinic called Trinity Homeopathic and also Counseling Center. I practice in Bangalore also and even in Tokyo also. If you come to my page, you can find my website. So we try to give homeopathic treatment in a holistic way. Maybe in the future minutes, I will try to explain how homeopathy stands out from other system of medicine. So basically, maybe in another 40 to 45 minutes, let us try to understand what exactly is menstrual disorders and how it can be treated through homeopathy and what best can be done from the other side. See, giving medicines is our duty, but from other side also, we expect certain changes as it is a lifestyle disorder. Lifestyle disorder
Thank you,
means
Kiran.
there should be certain changes in your lifestyle so that we can achieve cure together, not only from my side or
Correct.
our side, means from the medicine part. We are going to give medicine and do
Correct.
some miracle. No, it doesn't happen like that. If you want to avoid relapses or if you want to avoid certain coming back of symptoms again and again, the best thing is making certain lifestyle modifications, even from your side. So let us discuss all these things.
Thank you, doctor. Thank you for telling about you. And also, the topic which is going to be discussed today has a huge impact on women's life. I was telling in the introduction, these fertility issues, fibroid issues, or thyroid related concerns are not something that come and go. When it comes, it is not just a physical concern, but also becomes a mental stress. Because women at the age when they are planning a child or when they are planning to reduce their weight, this is definitely a great concern. So you doctors help us a lot, and hearing from you, our audience will be very happy. I shall take questions one by one that we have noted down, and people, as I was telling initially, please keep posting your questions, because towards the end of the video, we'll take up all those and inform you. I mean, the doctor shall inform you about it. So the
Sure,
first
sure.
question for the day is most common types of menstrual diseases that people come with to you, menstrual concerns or disorders.
So let me first tell what are these menstrual disorders. See, being a woman, when a girl attain menarche till she have menopause, in between this, what this age is called as reproductive age or the middle age, she gets menses every month, right? This is called as regular cycle. Any disturbances, either it is related to the quantity of the flow or maybe the pain related issue or any other mental symptoms before and after menses, all these are considered to be menstrual disorder.
Sorry
As
to
well as
interrupt. Sorry to interrupt. I think it is the right time to get my question answered. For a long time, I have been willing to know why is it that doctor, whenever he meets a woman, asks first, is your menstruation on time? Is the cycle good? So please educate us on that, doctor. Why is every doctor,
see,
most of the time,
yes,
we are
yes,
being asked this
yes, yes,
question?
yeah. See, basically, any women is having basically two important hormones called estrogen and progesterone. They should be at the right amount in our body, and it keeps fluctuating in every cycle. Every cycle has three phases, right? So every phase has to be keep on changing with time. Okay, what I'm telling is, so the very important thing for a woman is the regular menses. If there is any disturbance in this hormonal thing, or if the hormonal fluctuations happen either because of the obesity or lifestyle, the thing, whatever the food they're consuming, or the sleep disorder, or whatever it may be, maybe the stress has become a very important thing. So many things can happen if there is any fluctuations of the hormones. Either it is because nowadays the PCOD has become a very, very important kind of disease. At least 6 women in 10 in India, they are suffering from PCOD nowadays. So many young girls, they come with amenorrhea, that is absence of menses nowadays.
Oh,
And
okay.
also the IT professionals who are working in the night shifts, who has the very much disturbance in their sleep cycle, too much of stress. These people are ending up with many diseases like maybe thyroid disorders or PCOD or PCOS or even some fertility issues. So any woman, she should have her periods regularly for every month. That is the best thing. If it is happening every month, well and good, your health will be taken care by your body itself. This is why the menses regularity is very much important.
Okay, okay. Coming back to the question, types of menstrual disorders that you see people with coming with.
Yeah. So, as I told that any disturbance in this menstrual cycle or menstruation is considered to be menstrual disorder. Coming to the types, it can be classified in many ways. The very simple thing is we can categorize it into three main types. One is about the bleeding, what kind of bleeding is happening to that lady. Second is about the pain. Third one is called as premenstrual syndrome. Coming to the amount of blood or the quantity of blood, what is happening in the menstrual cycle. First one is called as metrorrhagia, or in the medical term, what we call as menorrhagia, metrorrhagia is nothing but a heavy bleeding. Usually, the girls who have just attained the menarche, or the women who is about to get their menopause, they end up with too much of heavy bleeding for 7 days, 10 days. They come and say that, doctor, it's been 15 days, I'm still bleeding.
Okay.
So in these kind of cases, uh, this heavy bleeding will be happening. This is one of the disorders. Second one is called as very light bleeding. Usually 3 to 4 days or 3 to 5 days, even up to 7 days. 7 days is considered to be normal. Usually it
Okay.
will be around 35 ml to 45 ml. Every woman will lose her blood during her menses every month. If it is below very much or above 45 ml, it is considered to be bit disturbance in her cycles. Second one is, as I told, that is which is called as epimenorrhea or oligomenorrhea. There are two types. One is called as epimenorrhea, where the lady will be bleeding only for 1 day. Just spotting is happening, doctor. I don't know, I'm not getting a regular cycle for 3 days. It used to happen for 3 to 5 days before. This is another abnormality. And the third time, the third amenorrhea, which is nothing but complete absence of the menses. Okay, so that is nothing but amenorrhea, what we call in medical term. What is amenorrhea means? Usually, client will come and tell you that, doctor, I have not got my menses from last 3 months, last 6 months, or last 2 months, something like that. Okay, that is absence of menstruation. That is another type when you think of the amount of flow or the quantity of blood. Coming to the second category in the types, that is nothing but the pain which is associated with menstruation. Usually many young girls who has just attained the menarche, in the initial years they can't bear the pain. The pain happens because of the cramps of the uterine muscles. Usually they get, some people will get a lot of back pain, they get pain in the thighs, some of the other variations will be there. But the main pain is associated with the uterine muscles, where the too much of contraction, the cramps will be happening, where they can't bear that pain, which is called as dysmenorrhea. This is another irregularity. Usually they end up with taking some home medicines or keeping hot water bag, or just gulping some Dolo or some painkiller or anything. They do that. But if it is happening to you every cycle, please make sure that you go to a doctor for a proper treatment. Coming to the third category, when you think of menstrual disorder, it is called as premenstrual syndrome. So, just before they're about to get menses, they end up in a set of symptoms either related to physical or mental. When you think of physical, they may tell that, doctor, I get headache too much just before I could get my menses, or they may say that I get migraine, I get lot of bloating in the body, too much of heaviness I feel in the body, or I get breast tenderness, I can't even touch my breast, it will be so heavy feeling, engorgement, tenderness will be there in my breast. These are the physical symptoms. Or too much of craving of food. Some clients usually, they tell me that I just gulp fast food if I am supposed to get my menses. So these kind of irregular cravings just before menses, all these are physical symptoms of PMS. Nowadays, this word PMS has become so.
PMSing. I know it
Anybody?
shouldn't be. Exactly. Even they go to
Yes.
men and ask, why are you so irritated? Are you PMSing? I don't think it is right to be
Exactly.
using it so casually. What do you say?
Yeah. I feel the two medical terms which has been abused nowadays is, one is depression, another one is PMSing. Any
Exactly.
lady or any man you ask, oh, I'm really depressed. Don't use that psychiatric term so easily. Depression is a very serious illness. So,
Correct.
in the same way, PMS, as I was talking about, the mental symptoms is usually they come and tell that I get too much of anger, or I get irritated, or I don't know, doctor, if I'm supposed to get my menses, I become very anxious or anxious, my husband or in-law or whoever it may be. I get irritated so much. So I don't know why did I react so much even for such a small incidents. These kind of things will happen usually.
Correct.
So this is all about the categories when you think of menstrual
Menstrual disorder.
disorders. These are usually the
Related is my.
symptoms. Yeah, yeah.
Sorry, go
I
on, go
want to
on.
add another one point here. You said that we cannot call diseases. Why disorders should be called? You asked me, right? Because these are the symptoms. If we group together these symptoms, I can call it as, oh, this is PCOD case, this is PCOS case, this is fibroid case, this is infertility case. So menstrual disorders are set of symptoms where it cannot be called as menstrual diseases, basically. So these are just symptoms. When patients come with these symptoms, we just try to take it and diagnose it as these or this disease.
Okay, okay. Well
Yeah,
clarified, doctor. That was much needed. My
yeah.
next question is, what are the causes for these menstrual disorders?
So the main understanding nowadays is if something is happening to some person, either they try to find out the cause on the outer part only, like at the physical part. Maybe she's not eating properly, maybe she's eating only outside, maybe she's not sleeping. See, this is all physical aspects. There are so many things which is related to mind
Internal.
also. How is her quality of life? How is her interpersonal relationship? How is her stress level? All these are also very much important. Being a homeopathic physician and also a counselor, we give lot of importance to mind also as much as the body. So as you said, I was not a person who used to eat junk. Maybe there may be other reasons also.
Exactly. Thank
Okay.
you for telling that. I would be confused otherwise. Yeah.
So coming to the causes of menstrual disorders, there may be there are many reasons. You cannot just pinpoint to this or that. The first thing is hereditary. Usually, when we are taking any case among the ladies whoever come to us, we try to ask about the family history, like how
Correct.
was the menstruation with their mother or
Mother.
the siblings or the sisters, any paternal aunts or maternal aunts. Hereditary, yeah, first one is
Hereditary.
hereditary.
Yeah.
The family issues has to be considered. The second thing is, nowadays too much of medications will be taking, like anticoagulant medicines like heparin or any other disease they would be undergoing, and they will be taking those kind of medicines, and it may end up with menstrual irregularities, or gulping simply the prevent they don't want to conceive, and they end up in taking too much of hormonal pills for that, oral contraceptives. It can also hamper the your menstruation. Or the third thing, usually the heavy bleeding, whatever I explained, the first category happens in ladies having some structural changes in their uterus, maybe the fibroid in the uterus, or polyps in the uterus. That is nothing but the mucosal inner layer of the uterus will be affected there. Or there are so many different structural changes that can happen within the uterus. So these are the structural causes which can lead to menstrual disorder. Other than this, again, the lifestyle things like not sleeping properly, not doing exercises regularly, or not in a good food intake or unhealthy food intake, all these things, sedentary habits, not moving around too much, all these matters. These are the causes which we can think. Or even anemia nowadays, especially in India, where which is a developing country, anemia is one of the very much reason. These are the reasons for menstrual disorders. Still so many are there. These are the things which are just coming
I
to
know,
my
I
mind as
know.
of now.
The main
Yeah.
things only we can even talk in this video because it is a 30 minutes live session that we are doing. And I
Yeah.
also have the next question related to the same things that you were mentioning, self-treatment medication. I told you my personal experience, and at that time I was taking one tablet. The first day I had to put that pill in, otherwise I couldn't survive at all. I'm guilty of using it, but now I tell women to consider going to a doctor. But what are the side effects or the ill effects of using the regular medication, like you just said about popping in a dolo or any painkillers? Because we undergo so much. Most of them are working women or college going children, school going kids. We have very less time for self care at that point of time, and our regular activities have to go on. We cannot stop them. So we are left with no option but some quick fix, and we think popping in a tablet is the only solution. But definitely, long term, it is not something recommended. So, what do you recommend in that case? First of all, please tell about ill effects, and yeah, what are the alternatives? First thing, you also said that going to a doctor is the best.
Yeah. As you're talking about self medication, just half an hour back I was going through an article, so which was talking about 6 children who lost their life because of too much of giving cough syrup to the children. As this page is all about the
Oh.
pediatrics also, I'm just sharing. I want to go
Mm,
through that
yeah.
article in detail anyways. So see,
Okay.
always self medication is not good. If you
Correct.
have an issue for 1 or 2 days, home remedies is good. Change of lifestyle modifications is good. Usually, if there was any indigestion, our forefather used to say, Langanam Paramoshadam, just fast for 1 day, you will be fine. All these things are really good. But if you are suffering every month, for example, in a menstruation problem, I'm just telling, please go to the concerned doctor and make sure that you take proper medications. Along with that, make sure that you do all those changes what she or he may try to tell you when it comes to your lifestyle. So let me tell a few points how we exactly as homeopaths try to attend the cases when it comes to menstrual disorder comparing to other system of medicines. See, in other system of medicines, I really don't want to talk about it much. Usually, the hormonal pills will be given to regularize the cycle. But we, as homeopaths, we believe in natural cure, where we will be stimulating the body itself to take care of itself. See, if my body is
Exactly.
not secreting certain hormones at a certain level, I should tell my body that please do your work properly, rather than taking something from externally, telling that okay, you take this and start functioning in a normal way. No, that is not the right way. That is what we believe in holistic way. If a patient has come to us, we not only ask about the menstruation. Usually the menstruation cases will be taken in very detail. Like if a woman has come to us, when was her menarche, how was her cycle before, how is her cycle now, how many kids she has, were there any abortions, if there were any abortions, what was the reason for that, how many days flow will be there for her, what kind of discharge she will be having, what is the color of the discharge, it is bright red or dark or black, brown, is it is clotted, or is she is having other intermenstrual discharge, like every 15 days some people will get kind of spotting, is it is there, or is she's having leukorrhea, the white discharge, is there any infection kind of symptoms with her, if there is leukorrhea, what kind of discharge it is. So many questions we bombard with the patient in order to understand her as a whole. This is at the physical level. If it is at the mental level, we try to assess what exactly is happening with her when it comes to her quality of life at the mental level. How is she with her people within the family, maybe at the workplace, maybe the interpersonal relationship with the husband or parents or in-laws. All these things matters to us being a homeopaths. So we consider everything together to give a medicine called constitutional medicine, which will suit to her constitution. So, for example, 3 ladies comes to me with dysmenorrhea, painful menstruation. I'm not going to give the same medicine for something like same medicine for 1, 2, and 3. No. What is happening with one? I may give one medicine. Second may change and third may change. What is the cause for that lady to undergo these symptoms? The root cause will be treated here. So this is where exactly we try to becomes different from other system of medicine. And the second thing is, we're not going to give any hormonal pills from outside to tell my body to work in a normal way. We are going to give some plant-based medicine or some medicines or some which has been prepared in a natural way, which is present in our nature itself. Maybe some minerals, maybe some plants, which will stimulate our body and tells that please work in a normal way. Okay. This is where homeopathic medicines differ from other system of medicine. And being a counselor, I want to add 2 or 3 points. In some cases, there will be so much of disturbance happening within the family, or some stress level will be always there for that lady. Even though we are trying to give the medicine, she may come out and she may have some cycles in a good way. Again, she may end up, because she's having the same stress. Okay? We try to counsel certain families also. If there is certain issues, has to be resolved. If that issue has not been resolved, she will be undergoing the same turmoil again and again at the emotional level. So this is another, not all case wants counseling. Only few cases which we feel like, okay, they need some help, even through counseling also, even through lifestyle changes also, even with medicines. In such cases, all the 3 mediums will be used. So this is all about medicines, no to self-medication. And also, if there is a few symptoms, like if you are bleeding more than 10 days, it is alarming sign. Please go to your doctor. Or if you are not getting cycles for 3 months to stretch, please go to your doctor. Don't do home remedies. Correct. So these are the few symptoms where you can think that, oh, I need to take a proper medicine or medications or treatment from
my next question was on that itself. What are the symptoms? So one is irregular period. If we don't get it after 10, if we are bleeding for more than 10 days, or if we do not see the cycle continuing for more than 2 or 3 months?
Yeah, one is that these are the alarming signs where you should go to a doctor. Okay. Coming to the symptoms, as I have already told in an indirect way, that one is heavy bleeding, one is very less bleeding, just spotting during your menstruation, or maybe absence of menstruation like amenorrhea, as I told, you're not getting your menstruation at all. And If you are getting too much of mood swings just before your menstruation, uh, maybe every woman will undergo that change. But if it is too severe, only 5 to 8% of women will undergo this severe PMS, where they end up in doing so much of wrong things under the influence of those disturbed hormones. Such cases are very much bothering physical symptoms like too much of vomiting or headache, where I can't do my regular things. They should, these are the few other symptoms as I told about PMS. And another thing is dysmenorrhea, too much of painful menstruation. So basically, these are the symptoms. Usually, when they come, when we assess, we may try to assess through some investigations like blood tests or ultrasonography or some of the other things. We may then diagnose what is the cause for their symptoms. As I said, maybe because of fibroid, maybe because of PCOD or PCOS or thyroid issue, we may tell them to undergo thyroid profile once, seeing the symptoms.
I got
So
it.
these basic things have to be considered.
Okay. My last question, doctor. What are the lifestyle changes that should be done to avoid any menstrual problems? Like women have been doing this you avoided, a little better it can get.
Yeah. So this I want to talk in big detail because 4 points I want to tell in very detailed way, because see, one thing is the food. We usually, if you are a working woman having too much of stress at home and also at workplace, we end up what is not supposed to be
Whatever
taken
is
for our body.
available.
Yeah.
Okay.
So start making very, very small changes. If I say these changes, you may say that, oh, this is so simple. But doing these small changes is very much important to have a very
Exactly.
drastic change in your health. For example, if you are a working woman, you are taking some snacks, you are too much hungry and you end up having some cupcakes or some bakery items which is full of maida, sugar, or too much of chocolates or fried food, salty food, something like that. No, carry some chickpeas with you, which is full of jaggery. Or I need not to tell you, I think you are the better person to talk about food now. You have given so much,
We
so
post
much.
lot of recipes, doctor. We keep educating women how easy it is to make healthy food. Most of them
Exactly.
understand and definitely they are on the path. But hearing from you, the importance matters. The recipes I can share, nothing more than that. Other things you
Yeah.
have to educate.
Yeah. Please carry some dry fruits with you, or please carry some chickpeas with you, which is full of iron and folic acid. Again, which is nowadays anemia is also very much bothering many of the young girls. And otherwise, you take some walnuts, or which is again a good source of iron and trace minerals. Anjeer, we will get no dry anjeer. It is a
Figs,
very good source
yeah,
of again iron and all.
exactly.
Yeah, pig, exactly. And pomegranate or beetroot salad, beetroot juice, or the papaya. These are great source of good things for women health when it comes to menstrual
Okay.
health.
What are
Second
the
thing,
vitamins or minerals that you recommend to be considered to avoid these menstrual diseases in nutrition exactly? What is that they have to look forward while they choose certain fruits, vegetables, doctor?
see, basically the iron and folic acid should be in a good level when it comes to women, especially regarding menstrual cycle. So iron rich food, maybe the dates, soaking the dates overnight and having it in the first thing in the morning, or as I told, the beetroot juice, or you don't want to discard the whole vegetable, okay, you just grate it and make
Great.
some salad, then have it, or just make some palya or the curry and have it. So these kind of lots and lots of vegetables and fruits have to be taken rather than going for some packed items, refined items, or too much of which is full of, like, so some people have habit of having cookies, biscuits, bun, bread, all these things. Just avoid all those things, you will be in a good
Coffee,
hands
tea.
when it comes.
Coffee,
Coffee
tea
tea is
is the
also another
most
thing. Yes.
used snack, I would say. And also, women having it early in the morning has become a practice because uh, what happens is, yes, men also help at cooking, but most of it is still women. And before starting, they cannot sit and munch on anything. So to begin the day, more than a glass of water, we switch to coffee or tea. So how can that impact? And what do you say? Early morning, what is it that women can start their day with? Apart from the snacks, is there anything that you recommend?
Yeah. See, early morning in the empty stomach, best thing for women is the fennel seeds will be there, no? Especially as a mother who is lactating and who is breastfeeding my baby, I just feel like fennel seed water is one of the magic water I can see. If you're in general also, or methi
Correct.
seeds water, or
Soak it in the
jeera
night and
water.
take it in the drink it in the
Yes, soak it
morning.
overnight.
Okay.
Just boil it and take it in the morning. You can strain it also. Either fennel seeds, methi seeds, jeera, or ginger. Just an inch of ginger. Make sure that if it should not be too much. Again, ginger can have some side effects also. So just an inch of ginger, boil it in water. Have it as the first thing in the morning, rather gulping a cup of coffee or
Coffee or
tea with some
tea.
biscuits or
Correct,
maida
correct.
cookies or anything. So, or even if you are a person who is having a lot of gastric issues, like some people will say that I have burning in the chest, heartburn, or too much of bloating, flatulence, or I feel like my food is not digested, doctor. Who are having the digestion issues, they can just soak 10 to 15 raisins, dried raisins, in the water and have it with along with the water, both the resin and the soaked water, the first thing in the morning. If you are anemic, I have already told so many other food items what they can
Okay,
have.
exactly.
So these kind of slight changes they can do when it comes to food. And second thing, the sleep cycle should be regular when you think of hormonal imbalance. As I told, 80% of my clients who are suffering from PCOD and thyroid, all are from engineering background. I'm very sorry to say this. All are working in some of the other MNCs or some of the uh, IT companies. So make sure that your sleep cycle is regular. Just before going to bed, browsing the Facebook, browsing the Instagram, till you get sleep, just browsing for 45 minutes, 1 hour is not needed actually. Just before you go to your bed, 20 minutes. Make sure that you keep your mobile away. Just be with yourself. Have some me time away from the family, away from everyone. It's just you and your thoughts. That is the best thing you can do just before going to the bed. So, and go to the bed on time. So, at least not waking up very late nights. All these things really hamper our hormonal. If we talk like this, no, it looks very simple, but these are the
It's
things
difficult to
actually
do.
bothering, yeah, which are bothering women's health a lot. And
Correct. Putting the simple
one
things in
needs
place
food.
should be helpful, is what you say.
Sorry.
Putting simple things in place like food, sleep, etc., are the only things we have to do, but it has become very difficult in this era to follow certain things.
Yes, yes. And the third thing is please don't take too much of medicines on your own until unless it is very much. Yeah. Don't have medicines on your own. Make sure that you take it from concerned people or concerned doctors. And this is the third thing. And the fourth thing is all about exercise. See, these are, as I told, is this is a lifestyle disorder. So lifestyle should be good. So make sure that you work out. I mean, anyways, maybe 20 minutes simple brisk walk in and around your house or any park. Being in Bangalore, we get park every 3 or 4 roads away. So go to a park, just have what we say, on 20 minutes of brisk walk, or do some yoga for 20 to 30 minutes, or any simple exercise. If you like dancing, go for dancing 20 to
Exactly.
30 minutes. Somewhere your body should feel that I have exercised for 20 to 30 minutes. This is the fourth thing. And what else I can say? These are the few changes, like lifestyle changes you can do for to avoid these hormonal issues which can happen. And also,
Got it,
so many
doctor.
information are also increasing. So this, if you want to avoid those things, also, this is the best thing you can do to yourself.
Got it, doctor. And what do you recommend young girls? Because these days, there are girls who get menstruation started at a very young age, and
Yes, yes.
definitely poor food habits are a cause, I would say, and you would also be with me. Please educate parents of young children. What is it they can do to help them have a good menstruation health for a longer term? Because at that age, we do not put on weight. Whatever the child is eating, we assume the child is digesting well. So let her eat everything that she wants to eat now, because tomorrow after marrying she will put on weight, and that is up to her what she wants to do. So these kind of attitude, again, which is definitely coming under lifestyle thing, I would want to add on, because we have parents here who have children of age 8. My child is of 8 years, about to reach that stage in a few years. So we as parents need to take care of certain habits. We only focus on academic situation of theirs. How well are they studying? We pull them back from even one single physical training class that is there in the school. We are okay with that. We go to the school and tell the teachers, please stop that physical education class. I want her to excel in maths. I want her to, she's poor in science. We also need to be conscious about what is happening to younger girls, the younger generation, for them to be okay with. We give a lot of pocket money, and every school has a lot of junk food around that they go buy, eat, they sit there. It has become a fashion statement to go to big brands like McDonald's and other things. And also, I see a lot of women influencers these days without hesitation promoting such things. So, what is it that you say at that age, at that tender age, what needs to be taken care? Pre-menstruation as well, and also while they are at their adolescence. You please tell us,
Yeah,
doctor.
yeah. As you have spoken about this early age of this generation getting the menarche very early, and maybe our forefathers generation, they used to get around 16 or 17 or even 15. At our generation, it used to be 13 or 14. It used to be the normal age. Now I really their children that at the age of 8 or 7 also sometimes, or even 9, they get their first menarche, the young girls. So that is not actually the age, that is where they will be starting to play in and around the house, and that is not the age where they should undergo this thing. So one thing, as we were talking about the food, nowadays the dairy products are also, I really don't want to
A
talk
big
about it that
reason.
I hope you know the amount of adulteration they are doing to the milk and milk products, and the amount of hormonal injection they are giving to the cows in order to get the good amount of milk, and how it is affecting not only these young girls, even in general the health of a woman when it comes to the bone health, or even maybe the menopause symptoms, or whatever it may be. So much of things are happening it concerned with the dairy products. So we should make sure that what we are consuming should be of a good quality. It is very difficult in this era where we try to go and buy the things so soon, and everything should be done in a very quicker way. But still we should be having some responsibility, not only towards us or our family, in general towards the society. Like uh, as I was very happy to see the products. Usually in our generation, it used to be only the Cerelac, what we used to feed if the baby is crossing the 6th month. Now, I saw so many videos of you speaking about ragi seri or jaggery. What is the importance? Not artificial sweeteners. I was very happy to
Sweeteners.
see something. See, these young kids, no, if you say that, okay, I will give you some French fries. French fries is overrated nowadays. I don't know why. Some potato which has been frozen, and which will be fried in some disgusting oil, and it is given so much of hype among the kids. Try to make your child to think that whatever my mother prepares at home, whatever
Is good,
we get at
healthy.
house, is really good, is really nutritious. Keep telling in a installment way to your children what is good and what is bad. Just don't give them wrong information, like I will give you the pizza, or I will give you the whatever these are, the no burgers or whatever is there. Please try to educate your children. They are not dumb, they are growing,
Correct.
they will understand very slowly. Try to make them educate them regarding the food, the selection of food, why you are giving this food to them. If a mother is trying to bake, her own cookies from whole wheat atta or ragi atta at home to the kid, rather than bringing some maida based some cookies from the bakery. Let her tell her child why she is doing this for my child.
Exactly.
They should understand the intention of the mother, why she is doing that. So these are the simple changes, I think, what we can do in our daily life, especially for the youngsters to make them understand. If we go to CCD or McD, or we
McDonald's,
see so
yeah.
much of high school
Young children.
girls and high school students sitting there and gulping the food. I really feel disturbed. We never had till the age of 25. We never. I'm very happy that we were not exposed to these ketchups or mayonnaise or pizza or anything. Maybe that is why, at least to a certain extent, our health is better. We
Exactly.
really, we really don't know how our next generation will be there. So it is our, maybe not only our responsibility towards our family. Maybe it has become a social responsibility also to look after all these minute things.
Thank you for saying that, doctor. It means a lot because our people will hear from you and they will do some minor changes which are definitely needed. We have so many parents who are on the path, and what happens is the society sometimes pulls them down. Even with me, this happened. I was on a trip recently with my children, and I had my father himself telling it's okay to give one cookies, it's okay to buy one ice cream. And all the places you travel, you find these junk foods. Nowhere would you find anything healthy these days. But I told him we could find some peanuts, we could find some gooseberries, we could find some chana and other things, which can be healthy options. Wherever we go, we just have to keep our eyes wide open and find out what are the healthy options for us and our children. And we have few questions, not many. Bhama has asked how to resolve menorrhagia postpartum. And is it because she has a history of it prior pregnancy? She's asking this. I'm not sure with her question in detail, but if you can get it, please ask.
Menorrhagia, she's asking.
Yeah,
Okay, I didn't get her name.
Bhama.
Okay, Bhamaji, let me tell you that menorrhagia is nothing but too much of bleeding. Maybe we need to consider how were your cycles before pregnancy also. Since menarche, what is the amount of blood lost? How many days you used to bleed? How is right now after delivery? After how many months you got your again menses? All these minute things has to be understood. So you, for that you need a detailed history taking as we do in homeopathy. Please consult any good homeopath in and around you, or you can contact me through email address or phone number which is given in my website through my page. We this is not something which can be done in 1 or 2 minutes or maybe 10 minutes of consultation. It needs time. So you should take a proper consultation in order to understand why menorrhagia is happening. I hope you're understanding. So this is where the holistic medicine differs. We need so
Exactly.
many things to understand that individual rather than the disease.
Exactly. What I remember is Dr. Arun, who had come to our live session, he was telling, Dr. Suraj, sorry, he was telling people repeat the same medication which was given to their child when he had a cough last time. But there are different types of cough, and not one medicine
Mm,
can work all the time. One time they may
exactly.
have dry cough, cold, or some mucus issues, or something that doctor has to check. And also, you told menorrhagia may be due to various reasons, and which is really
Yeah.
enlightening. And every time I talk to a doctor, I learn new things, and I'm sure our people are also learning that. I have another question by Nafria. She asked, when does the delivery start after periods? I mean, when does the period start after delivery? Her
See,
question
it
is
depends. It depends on each individual. Okay. Some people, if they are lactating,
exactly.
if they are breastfeeding the baby, it may go up to 8 months, 10 months. They don't get their menses at all up to 9 months or 10 months. They can be easily free from menses and easily breastfeeding their baby. Some people, especially if they have undergone, usually they say that the mode of delivery, either it is normal delivery or cesarean, that also matters sometimes. Or some people may get even just after 40 days of delivery, means just in 1 month of gap
Yeah.
It
First, you would be
depends on
bleeding post
each
delivery,
individual.
and immediately you would get that. That also has happened. Yeah.
Exactly. Exactly. So you cannot fix a time as nowadays
But
menarche
until when,
is.
if it doesn't happen, you have to visit a doctor. Until when, if, like 1 year or 2 year, if it is not happening, you have to visit a doctor. When is it? When is it an alarming situation? Just asking for help.
Yeah, just after 10 months, if still it is not happening and you're not seeing any changes also, you can talk to you can talk once to your doctor regarding what is happening. Is your baby still on complete feeds? Like even though the solids have started, maybe if you are feeding the baby for 7 to 8 times a day or 6 times a day, make sure that you talk to your doctor regarding your lactation, how much you're feeding, how many months of delivery has already happened. All these things, maybe after 10 months, you can talk to your doctor. Till that, you can
Okay.
wait.
Fine, doctor. Thank you so much for all these details. And as you were telling, I would like to reiterate, doctor says homeopathy has the best medication for menstrual disorders. In a holistic way, they treat it. Doctor here also does counseling on her personal account. Please do check her website. Dr. Anuradha is an amazing doctor, an amazing human being. And for what I have heard from her, she definitely wants things to be done in a natural way. And that's what we all need. Instead of just popping in some tablet, we all want it to be cured permanently with in nature and with things that are good for us. And for a long term, we wouldn't want it to happen or repeat again. Then we have to go natural way only, is what I have heard from many doctors, and I'm sure doctor also agrees. Before leaving, what are the few things you have to tell us,
I
doctor?
think just concentrate on the lifestyle because nowadays most common diseases, either diabetes or hypertension or these menstrual disorders, endocrinological disorders, either thyroid or infertility, whatever is happening, it is all because of the lifestyle. So let us work on that. Let us have some responsibility not only towards our health, our family health, our relatives' health, but also towards the social responsibility of what is happening throughout the society, and let us make certain changes at our home level so that we can have a better society for the future generation.
Thank you so much, Doctor. Please follow Dr. Anuradha Rao's account and also follow our account if people are there from other pages or something. This is Tots and Moms account where we talk a lot about healthy food. We share a lot of recipes and parenting topics are also spoken about. And Tots and Moms is a food brand. You can check our food products, which are chemical free, preservative free, organic range for babies, kids, and even moms have certain products like they can choose from our healthy range of millet jaggery cookies. For kids, we have instant mix and cereals. For younger toddlers, we have health drink mixes made of jaggery, no sugar, no maida, no chemicals like that. Do check and do follow both the accounts. And we are really happy that you joined us. We really hope that you would follow both the accounts, ask us your doubts, and we support you further. And yes, this video would be saved for your future reference. If somebody has joined recently, you can go to the video later and do continue it from the beginning. Thank you, all of you, and thank you, Doctor, for being here with us, giving your precious time to us.
Thank you so much. I'm very happy to be part of this program. Thank you.
Good day, Doctor. Bye bye.
Bye bye.